everyone. Thank you all so much for joining this evening for our Men's Refining Your Features webinar hosted by Dr. Alexandra Mayer. I'm Olivia with Ethos Integrative Medicine. I'll be moderating this webinar. Before we start, please remember to mute your microphones, and if you have any questions, feel free to type them into the chat. Be sure to answer them at the end. If you have any specific questions pertaining to your personal care, I highly recommend scheduling an aesthetics consult with Dr. Mayer. She'll be able to answer your questions and help you to go over treatment options. So I'll go over more of that at the end. Today is all about refining your features. We know that when you look great, you feel great. We'll be diving into popular and effective and simple aesthetic treatments that can kickstart hair regrowth, smooth out deep wrinkles, and preserve your good looks for years to come. I'd like to start off our webinar by introducing our medical aesthetics expert and women's hormone specialist, Dr. Alexandra Mayer. She's passionate about helping her patients show up big in their lives, meaning that they feel great in their own skin and energetic, strong, and vibrant. That's why her approach to care is designed to balance immediate improvement with long-term results. And I hope you all get the chance to connect with her, as she is a fantastic resource for all things aesthetics. Without further ado, I'll let her get started with her presentation.
Thank you so much, Olivia. All right, so welcome everybody. We named this webinar Refining Your Features, and I think that that is a really good tip-off point for aesthetics when it comes to men. Oftentimes in my office, I find that men really want aesthetics treatment plans that help them age like a fine wine, right? Men get this idea that as they get older, things actually get better, right? And so a little wisdom, a little bit of age can actually be really, really helpful in men. And so their treatment plans want to make that shine. And on top of that, Olivia mentioned simple. Simple is really the key. So there are a few things, a few like key treatments that I think are really helpful in men that I am going to run through today. Okay, so like I said, men's treatment plans are different, and they're different for a number of reasons. So oftentimes men's goals are really different than women are. So when women are coming in, they're often a bit more like they have a very specific thing that they don't like in their skin, or they might want their skin to look a little bit more like perfect. Whereas I find that men still want movement. They want to look really natural, which my women do too, because I do not make people look unnatural. But they want to look really natural, and they want to just look really, really good for their age. So their goals are a little bit different. Their product routine is different. So the majority of men coming in my office, it pains me to my very core to say this, but they're washing their face with things like bar soap, right? And so we can't go from things like bar soap all the way to like a 20-step treatment plan. And so oftentimes with men, sometimes people surprise me, but oftentimes with men, we just keep it really simple and really effective. Whatever is the best treatment plan for what you have going on in your skin, that is just a few steps. So it's easy to add in, doesn't have any problems. And then the third thing that we want to think about is downtime for procedures. So a lot of the time, men do not want people to know that they've had procedures done if they've chose it. And so we really take this into consideration. How quickly can you go back to your life? It's harder for men to cover things up if we've done things that are a little bit harder to recover from, right? And so we have to take that into consideration. And when we're talking to men, that is important to discuss the downtime and to maybe consider treatments that don't have downtime if that's important for the person. So let's talk about what we're actually seeing when we're looking at the skin. One of the things that we do differently at Ethos is that we really like results. We are a very results-driven clinic. That is how we do things here. And our skin approach is no different. But I like results in a really natural way. Right? I want my patients to go out into the world and to have people be like, damn, you look good, versus like, what did you do? Or what did you have done? They're totally different questions. And so we want to measure things, right? What gets measured gets treated. And so we brought in this Visia facial complexion analysis, and it really allows us to get numbers. And numbers means that we can make sure that things get better. So let's talk about some of the things we're looking at when we're assessing a male's skin. So first of all, we're assessing things that we're usually thinking of, like wrinkles and texture. So that's really going to be changes in the skin tone, right? Changes in laxity and then texture often comes from scarring. And those things really change the way that our skin is perceived in terms of how clear and bright it looks. Brown spots also do that. So when we think about brown spots, they actually did a study and they found that on average, if we superimpose dark spots onto somebody, people will guess about 7 years older. That's because it really changes the way that the skin bounces light off of it. And so instead of looking bright, clear, and even, the eye perceives it as dull and pigmented, which it is. So that makes a huge difference. So you'll see that there are 3 kinds of spots on here, which is kind of weird, right? So there's spots, brown spots, and UV spots. So UV spots are deep, and we really care about measuring UV over time because when it comes down to it, your skin, what's going to show up on your skin in the future comes from the UV spots, the UV damage underneath. UV damage is the #1 thing that's going to affect our skin as we age. And so really paying attention to that and treating that is important. Brown spots is that UV damage has already come to the surface of the skin, right? Oftentimes we see them more on the driving side because it's more exposed to light on a regular basis. And then spots are going to be changes in the top of the skin that show up like spots, sometimes like red spots. Sometimes they can be like a little bit of like an acne scar kind of spot, but they're not considered hyperpigmentation. Okay. Then we're going to look at 2 other things. Well, 3 technically. We're going to look at red spots, so red areas. So red area is inflammation. So in patients who have things like rosacea, or sometimes men's skin will have a little bit of that red undertone, like it looks really inflamed. That's going to show up like redness. Again, right, that makes our skin just look unhealthy. And so there's so many different effective treatment plans to get rid of that. So that is something that we want to assess. And then pore size. Unfortunately, pore size is very genetically determined, right? But the visibility of our pores, we can change. So when we want to think about pores, what we want to think about is the debris kind of getting into the pores and oxidizing or causing that change to look more black, right? Where the eye picks it up better. So what we want to do is we want to try and decrease the visibility of those pores. And there are treatments that help with that, and then products that help with that, which we will talk about. And then porphyrins are bacteria on the skin. Oftentimes with the porphyrins, I mean, we really worry about this if patients have acne, if they're struggling from acne, then we would really worry about the porphyrins. And then what's important to think about with this is that the way that the Vizia works is that it compares your skin tone and your age to people of your cohort. So if you're, for example, my husband, Matt, and you're a 33-year-old male, it's going to compare you to other 33-year-old males that have a similar skin tone to you. So it's actually basically telling you, how do you stack up, right? And a higher score is better. So closer to 100. 100 is like the highest score. So what we want is we want to bring those scores up, and we should see that over time. So the first treatment we want to think about for men is just a common treatment, and it's Botox. Botox, although I think it used to be thought of as a very female thing to do, it's not anymore. A lot of men get Botox. So we think about this when it really comes to fine lines and wrinkles. That is where Botox is going to shine. The analogy that I use is if we have a piece of paper, right? And we like fold the piece of paper gently one time and then we smooth it back out, the line's probably not going to stay there. But if we continue to fold that paper over time, right, or we crease the paper, eventually the structure of the paper, the integrity of the paper is going to go down, and we're going to end up with a line. That's exactly what happens in our face. So as we make faces that we usually make, everybody has their own favorite expression, right? As we make our favorite expression, sometimes those lines can etch into our skin. This is especially true as we age when we're losing collagen and elastin, which we'll talk about soon, but when we're losing collagen and elastin. And so the integrity of the skin is already diminished. And then we're using that a lot and kind of etching those lines in. So Really, the most important part with Botox in men is that it's different from Botox in women. If you inject Botox in men the exact same way you inject Botox in women, you will change their face and they will not like it. So really, when it comes down to it, right, women, this all has to do with the facial structure, particularly when it comes to the eyebrows and the forehead. So men have a deeper forehead and a lower, more horizontal brow. Women, on the other hand, have a higher, more arched brow, right? And I think intuitively we know this, but treatment-wise, it really changes things, right? So when you're injecting, you can see the pattern. This is like a rudimentary pattern for women, but like you can see the pattern for women, right? We keep it high above the eyebrow because you don't want to lose that arch. That's going to make her face look very masculine, right? Versus in men, if you were not to march the Botox across a straight line like that, right? See how his kind of marches across a straight line. What's going to happen is you're going to have the opposite. You're going to raise the eyebrows and feminize the features. So the way we do it matters. I really, really love Botox for men if it's done correctly, because we can leave a good amount of movement. Men can look like really, really natural, but just get rid of some of those heavy lines in your face, right? The other area that I love this in is the crow's feet, because over time, right, we want to be smiling, we want to have emotion, we want to be happy, but we don't want that to stay in our face for the rest of our lives. And so Botox can really be a great way to soften out those lines so we just don't see them as much. So the next treatment I want to talk about is one of my favorites for men. And the reason why is because you can see here that it has a large amount of efficacy in a large amount of areas. So RF microneedling is great for fine lines, it's great for skin laxity, it's great for visible pores, and it's great for skin texture and scarring. So it kind of is like the holy grail of all the things that we talked about, right? With the exception of hyperpigmentation and redness, right? Which we can treat in other ways. So let's talk about the science of microneedling. Basically, what we're doing with microneedling is we are asking your body to build collagen elastin, right? So if we go back to that analogy of the paper, what's happening and the reason why your skin eventually etches those lines in is that the integrity of your skin changes as we age. Collagen elastin declines pretty a lot each year as we age. And as we get older, as hormones change, things like testosterone change, right? We also see decreases in collagen elastin. So that's when our skin becomes more lax and when those lines set in. What microneedling is doing is it's telling the body, hey, let's heal, right? So the analogy that I use is if we had a kitchen knife and we cut our hand open with a kitchen knife, what ends up happening is we fill that wound with collagen, right? We stimulate fibroblasts and we fill that wound with collagen so that we can heal up that scar. That is a large amount of trauma, right? So it's a big trauma response and the body goes, yeah, let's fill it. That's how we end up with a scar. And the collagen that is put in has a different density, a different way of laying than normal collagen. So normal collagen kind of like nicely stacks on top of one another, right? So in microneedling, what we're doing is we're creating just enough trauma that the body goes, ooh, that's not good. I need to heal that, but not enough to scar. And so when we go to a lot of the science is in like the microneedling field. So I do microneedling with PRP. I'll tell you why I focused on RF microneedling for men in a second. But microneedling with PRP, what they did was they actually did a split face study, and they did a biopsy before, and then they did a biopsy after on both sides, right? So what they found is they injected in each participant half of the face with micro injections of saline. So think micro injections of water, basically microneedling, and then half of the face with micro injections of PRP. And they found that on the micro injections of saline, they got a 46% increase in collagen production on biopsy. On the micro injections with PRP side, they got 89.5%, which means that it as much as doubled the efficacy of the treatment. that shows the power of just injecting needles into the skin, right? If all you did was inject needles into the skin, your body's going to start to heal itself. So when we go to RF microneedling, the difference between regular microneedling and RF microneedling is that in RF microneedling, if you have the needle that's going into the skin similar to microneedling, RF microneedling is an insulated needle all the way up to the tip. And basically what happens is it injects deep into that dermis. That's really important. It injects deep into that dermis and then it lets out heat energy. Basically, this allows us to create a larger trauma response in that dermis and create more collagen. Okay. Being in the dermis is really important. That's where we build collagen. So a lot of treatments when we're going for like more superficial treatments, or we're seeing treatments in estheticians live in the epidermis of the skin, which is the upper layer of the skin, right? That's not where we build the most collagen. That's not where we build collagen production. You really want to get to lower layers of the dermis to do that. So that's important. The other thing by keeping that heat in the dermis is that we don't have as high of a risk of hyperpigmenting. Okay, because pigment lives in the epidermis, and we can get better results, but with less downtime and less side effects, less like negative effects. The other thing is that we can treat all skin types, which is great. The reason why I focused on this is because in terms of getting rid of fine lines, erasing fine lines, and skin laxity, this is hands down one of the best, most effective treatments for that. Skin laxity is really where RF microneedling shines. And in men, sometimes they do want their natural face movement. They just don't want as many lines, or if their under eye area is starting to bother them and sag a little bit, this can be a really great way to start to erase out those lines, but with keeping that natural movement. The other reason why I focused on RF versus regular microneedling for men is because regular microneedling can leave a little bit of pinpoint bleeding. That's good. It means that we got a good endpoint. But it can be kind of challenging for men in terms of downtime, right? Because you can have these pinpoint bleeding and kind of not uniform redness for the next couple days, which if men don't want anybody to know that they had anything done, that's not going to work for them. RF microneedling, on the other hand, because of the heat component, it actually doesn't have as much of the pinpoint bleeding. And it has a more uniform redness that goes away really quickly. I would actually say that this is a zero downtime treatment. The next day you often look maybe like you have a mild sunburn, but it's very uniform. Your face just might look a little more pink than it usually does. But it's really, really an easy treatment for men. Downtime wise. And so that's why I focused on this one versus regular microneedling, although I do love both. I think that makes it a really, really good treatment. So let's say you are like, okay, cool, that was helpful, I'm really not ready to go to treatments. Then here's where you start. If you get one thing from my webinar today, it is start here. This is our super easy, super effective treatment plan. I'm going to go through this. So with men, a lot of men are not using really great products on their skin, or they're using things like bar soap on your skin. Well, why do we care if you use bar soap? So bar soap has a pH of about 9.5, and our skin does not have that pH. So that's very basic for the skin. When we use things that are really basic on the skin, that's going to leave it to be dry. It's going to disrupt our skin barrier, and it's going to actually degrade collagen and elastin. It's going to help keep your skin not healthy over time. If I had one recommendation, if you walked away and you're like, I'm doing one thing, that's it, that's all I'm doing, I would recommend the cleansing complex. I will tell you that the majority of people will not agree with me on this, but this cleansing complex is basically, in my opinion, a treatment and cleanser all in one. It's going to leave your skin soft. It's going to leave your skin super clean, and it's incredibly anti-inflammatory. So I've had patients who have just started on the cleansing complex, and then they've converted to a whole bunch of other skincare because that is a strong enough product just to make the hugest difference in their skin. Obviously, this entire regimen is what I recommend, but the cleansing complex really is the world's best cleanser. Can't even count at this point how many really great cleansers that I've used, like really expensive, really good cleansers. And every single time I throw them in the garbage and I come back to the cleansing complex. And my patients feel the exact same way. So let's talk about the treatments, right? So when we cleanse, that is like the basic, right? If we're starting on a bad note, nothing's going to go well. So we need to start on a good note with a really good cleanser that's actually effective and going to do what we expect it to. Then we want to layer on stronger treatments. So the first thing that I suggested was Vibrant C. There's a few reasons why I suggested Vibrant C. So Vibrant C is a cream-based vitamin C, which makes it very unique. And the cream-based vitamin C allows that vitamin C to absorb deeper. So it's tetradecyl hecyl ascorbate. Say that 10 times fast. And it goes deeper into the skin, deeper into the dermis. What's really important about this is that because of that, it stimulates more collagen production. So when we're thinking about reduction of fine lines and wrinkles, that's going to be a really good option. The other thing is, because it has a cream base, it does have a little bit of that hydrating quality to it, right? So in some patients who aren't used to putting anything on their skin, it can be just enough hydration that we're not needing to add like a whole bunch of other products on top of it. On top of that, as if that's not enough, this product will also decrease melanin synthesis. So it's going to help with decreasing dark spots over time. And it's going to help with the help to brighten the skin and help to make sure that those pores don't oxidize, so that we're decreasing the visibility of pores in the skin. So it really is like, I would say a 1-2 punch, but it's really like all the punches in one product, easy to use as a man. So this is your treatment strategy. Treatment strategies always go on after your cleanser. So it's cleanser, then treatment, and then sunscreen. So I did recommend our HA Mineral Defense. This is extra important if you were to do the retinol. And we'll get back to that in a second. Extra important if we were to do the retinol. The reason why we named this sunscreen kind of like the best sunscreen you'll ever use is because it accurately is the best sunscreen you'll ever use. It is zinc and titanium oxide, so it doesn't have any chemical disrupting in it. It's not going to disrupt your hormone production. It has HA in it, so it goes on smooth like silk on your skin. You actually want to use it. The only thing with men that sometimes gets them at the very beginning is that it is lightly tinted. The tint is actually really important because it protects your skin against visible light. So zinc is really good for protecting your skin against UVA, which is aging rays, and blue light. So your computer screen, that's good. Titanium is really good at protecting your skin against UVB rays, burning rays. But then there's a whole host of other visible lights that we are exposed to that still are helping degrade our collagen production over time. Tint actually helps to reduce that visible light assault on our skin that we're getting every single day. So it's lightly tinted. The majority of men initially kind of like are a little hesitant on it, but then we rub it into their hand and you don't even see it. Like you literally don't see it. It goes on so light. And it is the world's best sunscreen. It is acne friendly. It is just all things friendly. And so that is definitely a recommendation. The other thing that we know is that UVA, so the UVA, the aging rays, and hyperpigmentation in the skin. So we talked about this, right? We talked about hyperpigmentation being a huge contributor to looking older, about 7 years older. But there's actually some really interesting evidence on the effects of UVA rays as we age. So there's this really interesting photo of a trucker, and the one side of his face is years, maybe decades older than the other side of his face. And that's because of those UVA rays coming through the window. We even get UVA damage on our skin when we're by a window. We don't have to be outside. And that's why a daily sunscreen is really, really important. So at night, right, we would do the cleanser, right? Because you never want to start on not clean skin. And then our treatment strategy would be a retinol. So retinols are literally the best studied anti-aging ingredient probably ever. And the reason why they're the best studied is because there's a pharmaceutical version called tretinoin. So tretinoin, the research on tretinoin is that it greatly increases collagen production. It reduces fine lines and wrinkles. It improves dark spots and hyperpigmentation. It helps exfoliate the skin and helps with skin cell turnover. So one of the things that happens as we age is that our skin becomes dull. And it becomes dull because the amount of time that it takes us to go through skin cell turnover. So to take a new skin cell from the base of where the skin cell is made up to the top of the epidermis can as much as double. And this just means that we're leaving older damaged skin cells on our skin longer, which makes it look more dull, makes it look more damaged, and also makes our products work less effectively. The other thing is that because of that skin cell turnover, it's going to brighten the skin and enhance the complexion. It also is really helpful for pores because, again, we don't want debris sitting in the pores, right? We don't want debris in there to oxidize. And so this is going to help make sure that we're constantly stimulating that skin cell turnover so that it doesn't sit there. So it is just all around one of the best anti-aging products. When it comes to tretinone's strong, and it can be really irritating, and it can be really sun sensitizing. And so a retinol like this will give you a large amount of efficacy, but a little bit less trouble using it. The other thing is that our rerun retinol has 3 strengths. So usually we start patients on like a 0.25, and then we'll move them to a 0.5 and then a 1 once their skin kind of exercises and gets into it. Because we know that the number one reason why people stop retinols is because they're just too drying. They're just too irritating to the skin. And so we can combat that by just going a little slower. The other thing with a nice cosmetic kind of retinol is that it's going to have elegance, right? It's going to actually help your skin barrier, and it's going to go on smooth and light, and it's going to feel good on the skin, which just means that you're going to use it, but also that we're not, putting something on the skin that's not going to be super beneficial in terms of its other ingredients, right? That we're really paying attention to the formulation as a whole. So let's talk about one of the other concerns. So we kind of went through skin and where I would start with skin in a male's treatment plan, in terms of getting them results. Let's talk about the other thing that tends to bring men into our office, and that is hair loss. So male pattern hair loss is staged with this staging scale. It's called the Hamilton-Norwood scale. So if you're at home and you're thinking about, am I losing my hair or what should I do about it? The Hamilton-Norwood scale is a really good place to start. So when we think about this, the majority of men, not all, because there's always outliers, but the majority of men, their hair loss starts at the front and works its way back in kind of like an M shape, right? At the front of their scalp. So in the early stages of hair loss, you're going to have a slight M. You're going to have that slight receding of the hairline, the slight change at the temples, okay? And then as hair loss progresses, that will go further back. Eventually, what happens is we then start losing hair at the vertex. Sometimes men lose hair at the vertex first. That's less common. And then eventually what will happen is they will kind of meet, and then you'll have lost your hair entirely over your entire scalp. When we're staging hair loss, anytime you notice hair loss in that area of the scalp, 50% of the hairs have been affected. So that's really, really important to think about, because if you're seeing hair loss in your scalp right now, that means that more has been affected than you think. We'll use this staging scale in just a second. So let's talk about the stages of hair growth. This is really important when we're thinking about treatment strategies. So basically, there's 4 stages of hair loss. There's the growth phase. There's the transition phase, where the hair follicle kind of detaches and goes into the telogen phase, which is the resting phase. In that phase, for about 30 to 90 days, the hair is just kind of chilling. It's resting until it gets shedded in the exogen phase, which then brings it back and will grow a new hair in the anagen phase. And it's a cycle, okay? So when we're thinking about male pattern hair loss, one of the first things that happens isn't actually normally loss, which might surprise people. What actually happens is the anagen phase shortens. So it goes from like 2 to 5 years to way shorter than that. And we care about this because it changes the way that the hair is perceived. So it technically, what it's called is miniaturizes the hair, which means that it makes the shaft more thin, right? So you can have a normal like volume of hair follicles, right? But not a normal hair density visibly. because your hairs are less thick and less robust, even though you have the same amount of them. A lot of this has to do with DHT. So DHT, if we think about hair loss, is like the thing that everybody stamps their stamp on, like it's DHT. What we know is that, yes, they've done research studies in men where they've biopsied areas of loss and then areas without loss. And in the areas of loss, there's higher levels of DHT at the level of the hair follicle. But there are also higher levels of other inflammatory components. And DHT is actually an inflammatory marker. And so the question kind of becomes, what came first, right? We don't really know. What DHT does is it chokes off those little tiny blood vessels that we can see there. And it stops that blood flow from going to the hair follicle quite as well, which means that it can't be nourished and will eventually like fall out faster. It'll thin and then fall out faster. A lot of our treatment strategies function to do two things, okay? They function to either increase blood flow or they function to decrease DHT. That's really where the majority of medical treatment is gonna fall into. There is another treatment that is more of an advanced treatment that functions to increase that anagen phase again. So it actually increases blood flow and increases that anagen phase again, which we'll talk about. So let's talk about strategies. So in strategies, there are a number of things to consider. First of all, we need to consider where we are in our hair loss cycle. How much hair have we actually lost, and is our treatment plan actually going to do anything? That's important. Are you actually encouraging regrowth, or are you simply stopping loss? We need to consider the longevity of the treatment. So how long does this treatment last? Do I have to do it, which is my next thing, frequency? Do I have to do it every single day in order to gain, in order to keep my gains? So a lot of treatments, what I mean by this is that a lot of treatments, they really do require a daily commitment. And if you stop using them, it doesn't make your hair loss worse, but you will just kind of revert back to where you were. In the majority of patients for some of these treatments, what will happen if you stop is that you'll just lose all of your hair that you've gained, okay? Then we have to consider side effects, because those matter. And, you know, with things like medications and certain topicals, there are side effects to consider, and then we have to consider cost. So when we're thinking about strategies, if you're going to a doctor, the number one strategy that every doctor, especially doctors that don't specialize in hair loss, will give you would be Rogaine. Rogaine is an over-the-counter, like minoxidil. That's the generic form. And basically what Rogaine does is it helps to increase blood flow. That's it. What's interesting is you'll see that I put topical rosemary oil and topical caffeine underneath Rogaine. And I put them underneath Rogaine because there's studies on both of those agents that went head to head with Rogaine and had really similar results. Well, that seems weird, right? It doesn't, because both of those things increase blood flow. And so all three of these treatment strategies, that's what it's doing. So with Rogaine, it really does work well to help the hairs that you have get more blood flow and get thicker. Have I seen Rogaine be like a really great treatment strategy for regrowing hair? Maybe not quite as much, but in some patients it does. And then this is one of those treatments where if you stop it, you will lose your gains, right? So in the majority of patients, if you stop it, any hair that's gotten thicker will regress and maybe fall out, right? Like normal. The other thing with Rogaine, so the number one reason why people stop Rogaine is probably frequency. So it's a 1 to 2 time a day at least application. And in my male patients, some of them just don't love that. The other reasons why people stop Rogaine is because sometimes patients will find that they get a different texture of hair as it grows. So what I mean by this is that sometimes you'll have men who have like nice thick hair and it'll come in like cotton wool, like weird. And sometimes you'll have women or men who have like more thin hair and it comes in really coarse and curly. And so that change is just disconcerting to people. The other reason why people would stop Rogaine is because of irritation to the scalp. So sometimes it can just be a little bit irritating. So I put topical rosemary oil there, and I put it specifically with pumpkin seed oil, and you'll see why in a second. With topical rosemary oil, if you're going to use that, it's a ratio of like 2 to 10 drops. So 2 drops of rosemary to 10 drops of pumpkin seed oil. And then it is like both of those things, or that with topical caffeine would be daily applications as well. Next down our list is Propecia. So Propecia, the generic name is finasteride, and basically it's a DHT blocker. And it works really, really well at the level of the hair follicle. When it comes to Propecia is really good at helping you maintain your hair. And the earlier you start it, the better. It does have a little bit of propensity to encourage growth. Again, it wouldn't be my top strategy if growth is really what you're looking for. But I do see this be helpful. Anytime we add in these medications, if I'm adding them in with other treatment strategies, the way and order in which we do things matters. I really like to add in Propecia kind of early, because that way I know if patients don't tolerate it, we can take it out and it's not going to affect the gains from other treatments that we've done. Okay. The number one reason why men stop Propecia is it's an everyday. You have to take it, but it's a nice, easy pill. A lot of men love it. The number one reason why men stop Propecia is because about 2 to 4% of men will have sexual side effects from Propecia. And it's one of those things where they start it and they're just like, nope, this doesn't work for me. And they stop it. And then we know that's not a good strategy for them. Other men won't start Propecia because the daily consideration of taking something just isn't something that they're interested in. So this treatment strategy can be wonderful. I do add Propecia in my men a lot of the time if it works for them, but if it doesn't, we need to go to something else. There are a couple other options for DHT. So sulfalmetto, which we often think about in prostate formulas, also helps to block DHT. It's not going to be as potent as finasteride, but that also means that it has way less side effects than finasteride. So a good version of sulfalmetto can be an interesting way to get a similar mechanism of action, right? But maybe with less of the side effects. The next thing that I think is wonderful is pumpkin seed oil. So pumpkin seed oil stops our conversion of testosterone down the 5-alpha reductase pathway. It decreases that. 5-alpha reductase, it makes our testosterone like 4 times stronger and is how we make DHT. And so pumpkin seed oil can help with some of that 5-alpha reductase pathway, and so can be helpful as a adjunctive in terms of hair. That's also why I use pumpkin seed oil specifically with the rosemary oil. Light therapy. So light therapy, the cool thing is with light therapy now is that it comes in so many different forms, right? Like you can do light therapy on with a baseball cap, super discreet and super awesome. Again, it's the commitment. You have to commit to light therapy every single day. And you will lose your hair, usually, if you stop doing it. And it really is functioning to increase blood flow. I almost never recommend light therapy to my patients. It's just not something that I usually do. Some of my patients have added it in on their own and have done great, but not something that I usually do. The commitment of the everyday usage is just a lot. And it is a lot it's time commitment too, right? With light therapy, you have to have it on for a certain amount of time versus Rogaine that's just like slather it on and be done. So a lot of time it just doesn't logistically work super duper well. And then being something that you're going to lose your gains, I usually don't go that direction. Next would be our 2 big hitters. Our 2 big hitters would be follicular unit extraction or hair transplant surgery and PRP. So hair transplant surgery, for that, you need to get it relatively early, right? Because what happens is they're transplanting hair from the back to the front. And at some point, they'll just run out of real estate, right? For that transplantation, and it's not going to work very well. So that can be a good option if you are a candidate. Some patients are not candidates. The other thing to think about with follicular unit extraction is that some patients don't like that the hair will sometimes look a little different than like your natural hair would have. The other thing to think about is that with follicular unit extraction, you really want to do something to make sure that the rest of your hair doesn't thin. Because at that point, they're transplanting hairs that are unlikely to fall out afterwards. And then you could lose your hair from the back, right behind your follicular unit extraction. So you really want to make sure that you're doing something to maintain the rest of your hair at that point. The next thing is PRP. So PRP is platelet-rich plasma. And I mentioned when we went to the hair growth cycle, right, that there's something that increases the anagen phase time back up to normal and increases blood flow. That is PRP. So PRP is basically we take your blood, spin it down, get the platelets, and inject it back into the hair, into the level of the hair follicle. This is going to stimulate vasogenesis, so the growth of blood vessels, and it's going to deliver growth factor to the area, which helps to stimulate normal hair growth and reset that anagen phase back to normal. This is a great treatment strategy for people who are probably 5 and below. Anything about that, you're at too severe loss, it's really a gamble. Usually my patients are doing this in like the 3, maybe 4 or before kind of range and getting good results. With PRP therapy, there's a lot of things to think about. So first of all, one of my biggest pet peeves is that I see a lot of people who aren't taking into account how long the hair growth cycle is, right? And so they're pushing patients through these PRP packages like boom, 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 boom for treatment, and then they push them into another series. That to me is illogical. The hair growth cycle is long and we want to give it time to grow. So in my practice, I don't go that fast through our series. We don't go turtle speed because nobody doesn't want results, but we give it time to grow. And then after our first treatment, we'll give it time before we decide for a second one so that we actually see what kind of results we're getting. The other thing to think about with PRP is that research shows that you need to be at 1.5 to 3 billion platelets per milliliter to get optimal results. That's a lot of platelets. I will tell you that we have a platelet counter in our office. We are the only place in Arizona, we're the only clinic in Arizona that has the platelet counter, the technology that we have. And we have studied a lot of different PRP systems that I've seen other offices use, and they're just not getting the concentrations that we're looking for. So really, when it comes down to it, in order to get 1.5 to 3 billion platelets per milliliter, you need to be drawing at least 60 cc's, which is a large syringe of blood, up to 120 cc's. And we really want to know where we're ending up. The other thing that we want to do is that we want to be able to tailor that treatment, because sometimes if we go straight to like a 3 billion platelet per milliliter treatment, it's going to be irritating to the scalp. So oftentimes I will kind of tailor it so that we get a lower number of platelets, hopefully in the reference range earlier, and then move it up throughout treatment if that's possible based on your platelet level. It really allows for better science, honestly. Better science, a more exact treatment. So we know what we're injecting, and we know that based on the research, it's going to be what the research shows is going to be most effective. PRP is a really good strategy for patients, especially if they have loss that's more diffuse. So covers a larger area, because we can treat a larger area with it. And unlike Propecia and Rogaine, we're not seeing that if you stop it, the results will fall out. Now, most of the time we do require some sort of maintenance with it, right? Because there's still that underlying hair process that's happening, that underlying process that's causing your hair to fall out. So we're still kind of battling that, but it's a really, really good treatment strategy. All right, so I feel like I talked about a lot of things today, but do you guys have any questions for me?
Yeah, if you guys have any questions, feel free to type them into the chat. We'll give it a couple minutes. In the meantime, I just want to thank Dr. Alex for hosting this webinar again. And thank you guys for sticking around to the end. We really appreciate it. I hope you learned something new about the factors that contribute to aging skin and aging hair, and treatments that you can do to restore and refine those features. If you take anything away from this webinar, like Dr. Alex said, start with a cleanser, take that away for sure. But if you take anything else away, I hope you realize that there is a physician out there who will take the time to understand your health and aesthetic goals and will work with you to create a solid treatment plan that's best for you and your lifestyle. Again, if you have any specific questions pertaining to your personal care, I highly recommend scheduling an aesthetics consultation with Dr. Alexandra Mayer. She'll be able to answer your questions and help you to navigate treatment options. And if you're interested about the Visia that we were showing earlier and you want those kind of skin analysis results, you can also get that in that aesthetics consult. So that's really jam-packed, a bunch of information that's helpful to you. So you can call our office with the number in the chat or message me your phone number and I can reach out to you tomorrow as well. But that's all that we had for this webinar. And thank you again to everyone for joining us. Hope you all have a great rest of your week and look forward to connecting with you soon.
Thank you so much, everyone.